Wing it and just say a couple important things. So we are Canada's Planned Parenthood Federation. We focus on access to sexual and reproductive health care. Every day we fight for people to have access to contraception, to family planning, to abortion, to gender affirming care, to fertility care, to midwifery. And the problem is we are often pictured or depicted as a nice to have or a niche issue, when actually access to contraception is a nation-building infrastructure. When people are able to plan their families, the impact are generational. When people do not have access to abortion, the impact are generational. And about half of pregnancies in Canada are unintended because people do not have the money to pay for the birth control they need. And I could continue on in terms of what is important in terms of access to sexual and reproductive care, but I'm actually going to focus on another important thing we need to talk about. When we get picked out one by one, we just heard from Alicia about migrant health care. Right now there are cuts and to some benefits to asylum seekers, to migrant workers, to refugees, to finance capital investment. Their health care has now been made co-pay. And the same thing is happening with reproductive health care, and it's being used to undo our national agreements on public health care because people do not see that those are the door through which we can go through for privatization. Because people do not always stand to defend gender affirming care, trans care, and abortion, but that is how people are undoing the systems that we have built for everyone. In Alberta right now, there are laws that were passed and there were motions that were proposed to defund care because of political opinions, when they are essential medical procedures, when they are now examples that can be used to continue to fracture us in terms of what kind of healthcare should be publicly funded. This is something we have agreed on as a country, and when we don't see the whole game, when we don't actually stand up for the kind of care that is used to wedge us, to polarize us, and we don't see the link with the defunding and the political interference in care in terms of their impact on the complete dismantlement of public healthcare in Canada, well, we are not seeing the whole picture. So it is time to stand together. Let's not be picked apart. We are not niche issues. We are here together to build a strong healthcare system that works for everyone and where everyone gets the care they need when they need it. Thank you.